Okay, welcome back. Dr. Ray Findji, Vet Triage. We are almost done with this November 2024 issue of Veterinary Surgery, where this is a small case series of 9 dogs, but a pretty cool one. Combined forequarter amputation and hemilaminectomy for the treatment of canine peripheral nerve sheath tumors of the brachial plexus invading the spinal cord, surgical technique and outcome. So this study comes out of a hospital in the United Kingdom. This one I like because peripheral nerve sheath tumors are always a poor prognosis, and veterinarians quickly go to either palliative care or euthanasia, depending on the case and the pet owner, and they don't really talk about folks who want to do everything. What options are there? What's the outcome? That sort of thing. So we're going to get into it here. The objective is the aim of the study. The aim of the study is to describe surgical technique and outcome of combined forequarter amputation and hemilaminectomy for excision of a canine peripheral nerve sheath tumor of brachial plexus, extending into the vertebral canal, retrospective, 9 dogs. For those who are interested in hemilaminectomy and other spine surgeries and neck surgery, I do have videos on my YouTube channel, so feel free to check those out. They're made for pet owners to understand better the general information on spine surgery. So 9 dogs, retrospective. So we already know that there's going to be problems with standardizing the cases, and it's only nine animals. Results: in 7 out of 9 cases, the tumor affected the 8th cervical nerve root. 5 out of the 9 were ambulatory within the first 3 days after surgery. Median survival 317 days. The mean 522 days. The range 120 to 1,620 days. 4 of 9 dogs were euthanized. 120, 270, 306, 317 days postoperatively because of tumor recurrence. And in one of those cases, histological margins were reported as complete. In conclusion, this surgical combination is reliable for the excision of these tumors, with similar outcomes from previously reported for peripheral nerve sheath tumors that are not extending to the vertebral canal. So they're saying with more aggressive surgery, it looks like, at least in a small case series, that the outcome may be as good as those that are not extending into the vertebral canal, which means for pet owners that want to do everything, you can get similar outcomes with less severe tumors. All right, introduction. Canine peripheral nerve sheath tumors have been broadly discussed. They are typically slow-growing, locally aggressive, similar to malignant peripheral nerve sheath tumor in humans. Nerve roots contributing to the brachial plexus, which are C6 to T2, are the most commonly affected, with the highest prevalence at C8. Peripheral nerve sheath tumors of the brachial plexus are believed to be able to grow along nerves either in a proximal or distal direction or both, but rarely breach the epineurium. These tumors extend into the spinal cord, lead to compression or invasion. Peripheral nerve sheath tumors are challenging to diagnose and have nonspecific signs. Surgical excision is challenging, but has been shown to be superior to conservative medical management when extramedullary neoplasia is suspected. Depending on the degree of preoperative limb function, the location, extent of tumor, and the presence of other neuro or ortho conditions, reported treatment options include local resection, forequarter amputation, hemilaminectomy, or a combination. A more favorable prognosis has been reported for those that are distally located tumors. In other studies, the distal extent of the tumor in the cases with intradural extramedullary peripheral nerve sheath tumors treated with local resection and or hemilaminectomy or laminectomy is not clearly stated. However, tumor occurrence within a year is reported in the majority of dogs, over 85% of cases. The delayed diagnosis, increased postoperative morbidity after spine surgery, and high recurrence makes the prognosis guarded to poor. So for this surgery, these cases were from 2014 to 2023. They diagnosed with MRI. The tumor typically appears as a circumscribed or diffuse, subtle to marked swelling of the nerve root or roots, and firmer than normal on palpation. They injected lidocaine 2% at a dose of 2 to 4 mg per kg in surgery. And so I'm going to show you some surgical pictures here. This first one is a forequarter amputation with scapulothoracic dislocation, and you can see the brachial plexus with the arrow. It's like spaghetti. There you go. That's the brachial plexus, and then in the pictures that you're seeing there on the screen, we've got, or maybe actually no, we're still not there yet. Those are more advanced. So I'm going to show you these pictures here. There you go. these pictures. There you go. All right, pretty gross. But we're going to talk about them. In the first one, we're seeing the tumor with the arrow can be easily visualized and palpated. Then the second picture, we've got here the roots are cut as proximal as possible with the hollow arrows, and the roots with the tumor that extend too proximally into the intervertebral foramen to allow for margins are left intact, and that's the full arrow. Then the final picture is relevant cervical vertebrae with the arrow are shown. So here are the images one more time, so you can see how they're slowly excising nerve roots that are not abnormal or where they palpate normally, and they're only getting more aggressive towards the spinal cord for the tumors that are obviously there or extending more proximal. So the macroscopic abnormal nerves were dissected approximately until 2 to 3 centimeters of macroscopic normal nerves were exposed. That's your normal margins. Whenever possible, if the tumor extended too closely to the intervertebral foramen, where the nerves exit, to allow these margins, but a portion of macroscopically normal nerve could be exposed proximally to the tumor, it was either cut as close as possible to the foramen or approaching into the canal via hemilaminectomy to get wider margins. And that's based on the surgeon's judgment. When nerves appeared abnormal, up to the intervertebral foramen, they had to be approached inside the vertebral canal by hemilaminectomy to achieve macroscopic excision. A durotomy was carried out dorsally to the identified insertion of the nerve root on the spinal cord, allowing vision of the nerve rootlets. And then now in the pictures that you see there on the screen, in this top one here, there we go, right here. So a hemilaminectomy is performed with the full arrow. So you can see here, this is the spinal cord here, and then this is the nerve root coming out of the spinal cord. One or several spaces to expose the portion of the affected nerves that are previously left intact, and that's the hollow arrow here showing a nerve root. And then in this top right picture over here, you're seeing there the A is durotomy, B is exposed nerve roots, and then the black arrow is the proximal extent of tumor. So the tumor there is encroaching onto the spinal cord. And then finally here, this is the coolest picture that shows you A is the hemilaminectomy with dura mater of the spinal cord. B is a vessel loop that's wrapped around the nerve sheath tumor. So that is rubber there, or whatever material, and it's around the nerve root. And the intradural portion of the tumor can be seen through the dura mater. All right, results. The most proximal tumor margins on the preoperative MRI images were documented at a greater distance from the spinal cord compared to that observed at surgery. 8 out of 9 tumors did not appear to extend proximally beyond the intervertebral foramen on MRI, but were found to extend to the subarachnoid space, so intradural extramedullary tumors. In 6 of 9 cases, the tumor was extending distally to the brachial plexus, and 7 out of 9, C8, was infiltrated by tumor. Based on the soft tissue sarcoma grading scheme, 3 peripheral nerve sheath tumors were classified as low grade, 5 as intermediate, 1 as high grade. Surgical margins were reported as clear in 5 cases, incomplete in 4, for which microscopic spinal cord invasion was suspected. 2 of the 4 cases with suspected incomplete tumor resection were later euthanized because of suspected tumor recurrence. Median survival time, 317 days, range from 120 to 1620. 1 dog still alive and healthy at the end of the study at 690 days. Tumor recurrence was suspected in those other cases. A second MRI scan in 2 dogs, 246 and 300 days after surgery because of neurologic issues, and tumor recurrence was suspected at the hemilaminectomy site. Discussion. Consistent with reported biological behavior, none of these cases showed signs of metastatic disease. It's been reported that 95% of the efferent axons, which those are the axons of the nerve roots that are entering the spinal cord, of the radial nerve arise from C7 to T1, with 45% specifically from C8. For this reason, and from previous experience, authors do not consider dogs with these tumors affecting C8 to be good candidates for limb sparing. In another study of the tumors affecting C7 and T1, they had a poor outcome with limb sparing. In selected cases of isolated involvement of C7 or T1 that still preserved good preoperative limb function, limb sparing could still be considered, but this was not the case in any of the dogs in the present study. A durectomy of the nerve sheath tumors invading the vertebral canal increases the chance of achieving full resection by facilitating the identification of the tumor boundaries, which can be viewed directly rather than through the epineurium, and by allowing wider excision margins as the rootlets can be cut flush with the spinal cord rather than the whole nerve root flush with the dura mater of the spinal cord, or dura mater. Most dogs deteriorate to some degree after surgery because of spinal cord manipulation in surgery and accessing the rootlets. 44% recurrence rate, lower than reported for invading the vertebral canal. Previously reported it was 54% to 78%. In this study, 4 cases were suspected to recur because of neurologic deficits and or pain from the hemilaminectomy site. And in one of the recurrent cases, the margins were supposedly complete. Previously reported median survival time for surgically removed tumors in dogs, 5 months, 6.2 months, 9 months, affecting nerve roots among the whole spinal cord. Only extradural, brachial plexus, peripheral nerve sheath tumors, and intradural, extradural, peripheral nerve sheath tumors, respectively. The median survival time in this study was 10.5 months. So yeah, so these studies I like because these are not common enough, but they're on everybody's differential list, and they're always a poor prognosis with not much options given to pet owners. So at least now we know there's options that are out there for veterinarians to get pet owners, and so they can make a decision with the specialist as far as what they want to do. All right, guys, thanks for watching. We'll see you in the next one.
Bye-bye.